We're going to talk about writing an op-ed and why it's important. And we're going to actually go through the process of kind of putting one together. This is by no means the only way of doing it, but having written a bunch of these, I kind of feel like it's one way of approaching this topic. There is a worksheet, and you'll see the worksheet on the slides that we've asked to be sent out to all those who are listening. And this is also an open invitation to let you guys know that this is just the start. So if you guys start putting something together and you need a little help, you hit a roadblock, um, you're more than happy to reach out to me, and we can get on a Zoom. Hopefully there won't be technical problems like this, and we can just sort of work on it uh, together. All right, next slide. All right, good. So it's critically important, and I think all of you guys do know this, that when we start thinking about healthcare, we need to start thinking more broadly. And that's particularly important for all of us who live our lives within the four walls of a neonatal intensive care unit, right? We know that there are social factors or social determinants that really impact children's health, so much so that at almost 25 years ago now, uh, there was a term for all of these, and they were called the new morbidities, right? In the 1900s, we were worried predominantly about saving the lives of children who were dying from primarily infectious causes. Um, but vaccines, hygiene, improved antibiotics, improved technology really got us to a point where a lot of kids don't have those types of illnesses. Instead, they have new types of illnesses, the new morbidities. And that includes things like poverty and all its long term, both health associated and economic associated sequelae, right? I tell people that poverty is the number one disease of children. When I was a resident, it was asthma. We have issues of healthcare access, parental stability, food insecurity, and of course, understanding the physical environment in which children live. And we know that when you take all these things together, they're about 15% of our overall health, some say even more, uh, is related to social determinants and social factors. And this is the here on the bottom is a diagram of the Center for Disease Control's sort of thinking around social determinants of health. And if you think about what the big advocacy issues have been in pediatrics at the state and even to some degree at the federal level, you can map almost every single one of them to a social determinant of health. And that makes it pretty clear that social policy now is increasingly viewed as healthcare policy. So education access and quality maps directly to universal pre-K. Fair housing policies. I don't know how many of you guys know Emily Miller, but she's working on ensuring that pregnant women are prioritized in getting free housing if they are homeless. That's a fair housing policy that relates to healthcare quality and access. Climate change, of course, as all people in California can personally attest to now, um, impacts the neighborhood and built environment, and that includes us even in New York. Last year, we all were living under increasing smog alerts because of increased smoke coming from Canadian wildfires. The child tax credit and a whole host of economic policies that contribute to economic stability and help lift children who are America's most impoverished group out of the federal poverty level. Those are now all seen as healthcare policies. So what's an op-ed, right? Well, an op-ed is basically an opinionated newspaper article that's authored normally not by the staff members of the newspaper, but by you, someone who's an expert or who has personal experience in the actual field that they're writing on. The whole point is that it provides the opinion of the author and somehow demonstrates the community's opinion, or how should the community should be thinking. And if done well, they're both thought provoking and entertaining. It's really a community sounding board. This is just an example of what some of these things look like. This is a couple that I've been able to do with a bunch of people in pediatrics. I don't know if anyone from Cincinnati Children's is on, but this was one that we did with Dr. Tina Cheng about healthcare access. For those of you guys who are from Boston, you know Jonathan Davis as a neonatologist. We worked with Massachusetts as they were trying to remove religious and philosophical exemptions from the school vaccine laws. And then there are a whole host of other op-eds on things related to immunization and children's healthcare access. But this just gives you an idea of what they look like when they're printed in the newspaper. The other thing for you to realize is that you're joining a really illustrious group of famous pediatricians and people who have written op-eds about illnesses. So I don't know how many of you guys, I always used to say, remember when, until all the fellows remind me that like they weren't born when I was in med school. But there's a patient named Suleika Jalud who graduated from college and a year later was diagnosed with cancer. And she was at the time an intern for I believe, the New York Times. And she wound up writing a whole series of op-ed columns about what it's like to be a young person with cancer, both in the hospital and out of the hospital. She was talking about being in the hospital waiting for her stem cell transplant to engraft, and she talked about what she called her incanceration instead of incarceration. And she developed a really large following. But what was amazing was she had a entire column devoted to how lucky she was because both her parents were actively helping her deal with all the insurance companies and all the pre-authorizations and everything that she needed, while all of the other patients on the ward weren't so lucky. And that actually wound up creating a little bit of a groundswell in terms of people being dissatisfied with the healthcare system, and more importantly, educated a lot of people. For those of you who don't know, you should know Dr. Perry Klass. She's a pediatrician, a professor of pediatrics and journalism at New York University, and she also writes for the New York Times. She writes a column called The Checkup, where she goes over topics in healthcare. Again, the point is to provide her opinion, but also to educate all of the readers about these types of topics. I didn't want to leave the Midwest out because when I was putting this together, I realized both of these things were East Coast things. But for those of you guys who are from the Midwest, many of you may or may not know Dr. Depesh Navsaria, who is a pediatrician and, of all things, a librarian. And he writes a column for the Wisconsin State Journal and does a lot of work with Reach Out and Read, talking about social issues related to child health, and literacy. So the point is that when you guys come to this, you should feel pretty comfortable that people who are just like you, pediatricians, neonatologists, have done this before. So why do we do this? Why write an op-ed? Well, there are lots of reasons, right? One is that it gives you a forum to immediately showcase your ideas and broadcast your ideas on a topic that is highly topical. And we'll talk about that because being really topical is one of the things that actually gets you accepted from, the hundreds of op-ed submissions that people get. It can raise awareness and increase the visibility of an issue. And, we'll be talking a little bit about the Preemie Act, which I can guarantee you is not top of mind of most people who are going to work or to the grocery store or going to be picking up a newspaper. The other thing to remember is that while you are writing for a general audience, for those of you who are interested in advocacy, op-eds are a great way to create something that will be read and hopefully educate legislators or their staff about an issue. I tell people this all the time. My son worked for a state senator over the summer during high school, and one of his jobs was to go through all of the local papers, the town paper, the county's newspaper, read the op-eds, and if they were about issues that were related to legislation, he was supposed to pull them out, put them in a scrapbook, and write a 1 or 2 sentence summary of what that op-ed said. It's a way legislators use to gauge public opinion. And if you've ever been to a legislator's office, whether it's a state legislator, a county legislator, or even your senator in Washington, D.C., take a look at the coffee table. You will inevitably find a copy of some of the local state newspapers on that coffee table. The other thing to remember is that increasingly more and more appointments, promotions, and tenures committee are actually looking at these types of things. It's not just all grants, publications, lectures, and abstracts, right? The ability to put op-eds into circulation and maybe change the way people think about these topics is really considered part of so-called quote unquote new scholarship, really recognizing the impact that neonatologists, pediatricians really play in advancing healthcare issues. So what are some policy issues of interest to TCAN? So what are just some of the things that you guys might be thinking of? And this is completely a list that I put together. So if you're not on here, then let me know. But so there are national policy issues that are important to you as early career folks and as neonatologists. That includes things like medical education debt and the pediatric subspecialty loan repayment program. At the state or federal level, Medicaid coverage for donor milk, or at the federal level, the Access for Donor Milk Act. A lot of federal Medicaid policies and how they relate to the access your patients are going to get, not just in the NICU, but more importantly, when they're discharged from the NICU. Those include things like Medicaid funding, which people are very concerned about in this new administration, Medicaid waivers, and state plan amendments, or SPAs. The PREMIE Act, which is kind of what we're sort of rallying around right now. And many of you guys probably followed the FDA's actions in eliminating probiotics. I'm sure many of you were in NICUs that were using probiotics and then abruptly stopped. But there are also tons of local issues. And these are things that might not necessarily be in the direct neonatology wheelhouse, but things you can still write on given your expertise as a pediatrician as well. Things like tobacco policies and gun violence. Again, eligibility enrollment and things that are happening within Medicaid. Let's say you're a lactation consultant or you're interested in breastfeeding or providing breast milk to your patients, right? Any payment for those services could be an issue. The whole point here is there's literally anything you can think of can be an op-ed. So this is just to give you an example. So there's an early career neonatologist, Sarah Bernstein, who's from, I think now is in Texas, but was in Utah. And we collaborated to talk about policies for postpartum Medicaid coverage in Utah and why they were less than ideal. So that's a pretty big issue. That's a statewide issue. But this was an op-ed that gained a lot of attention in 2015. For those of you who are in Boston, there's a garden apparently, or there was a garden in the children's hospital, and they were planning on knocking the garden or like getting rid of it to build new construction. And it was a lot of staff at that hospital who lobbied in local newspapers to have the garden be saved. So it gets as local as the park in or around your children's hospital, as high as state policies, and as broad as national policies. So basically anything. So we're going to be talking a little bit about the PREMIE Act. We're not going to do a really deep dive into it, but the whole point for you guys if you're going to write an op-ed on the PREMIE Act is to just understand what it does. So what are the key points of it? Well, the first thing it does is it renews the CDC's research on preterm birth. So when you guys go to the CDC website or when you look at things like peristats to look at preterm births and very low birth weight babies in different states, all of that comes out of the extraction of CDC data. The other thing that it does is it reauthorizes the Health Research Services Administration, or HRSA's, activities on healthy pregnancies and preventing preterm birth. And for those of you who don't know, what HRSA does is it provides grants to hospitals to help improve or move the needle on certain healthcare outcomes. So what are some of the things that HRSA has directly done that we might be interested in? Well, it funds hospitals to provide early identification and treatment for preeclampsia for patients who might otherwise have health insurance. So if you're pregnant, it allows you to screen them. For those of you who are at level 3 or level 4 referral centers, you guys know that you'll receive patients from level 1 or even level 2 centers. However, we all know that the golden hour, the time that they spend at that outpatient facility, can have an outsized impact on how those babies do. So HRSA funds mobile simulation trainings for people at those hospitals because they're going to see the 25, 26 weeker once or twice a year and not every couple of days. And so they need to go through simulation so when that baby does come, they can really do the best that they can and maximize that child's health outcome. So that's a direct thing that HRSA funds. The other thing that's going to happen is that for the first time in over 20 or about 20 years, it's going to fund a new study on the cost, social factors, and research gaps that contribute to prematurity and preterm birth. Now, those of you guys probably well, may know or may not know that the last time we did this was in 2006. And they estimated at that time that preterm birth costs $26 billion a year. And many of us would just inflation adjust this number to 50 some odd billion and say that's how much preterm birth costs. But the important part about this report is that not only would it tell us how much we're actually spending on preterm birth, but it would really identify gaps in the literature where we can focus our research efforts and our community outreach efforts to try and prevent babies from being born early. Because activities related to preterm birth can occur at HRSA, can occur at the CDC, can occur at the National Institutes of Health, it would coordinate all of those programs. And all of this, by the way, costs about $10 million. That's $9 million for the research and education. That's the HRSA and CDC, and then $1 million for the work group and the report, which when you think in the context of a, multi-trillion with a T federal budget, I think is a pretty small request for one of the number one killers of children under 1 year of age. So the first thing you need to think about before you start writing an op-ed are four sort of basic questions, right? So what are you arguing for? What do you want people to do or to learn about as part of your op-ed? All right. Why do people need to know about it now? What makes it timely, right? A newspaper is a daily newspaper. So something that's 2 weeks old or 3 weeks old isn't necessarily going to be as attractive to the op-ed editor who's looking to choose the op-eds that would appear in the paper. The third thing is, why are you the person who should be writing about this, right? That's no different than when you write a grant and you talk about how like you're the only lab that researches this or you have this great track record, right? What is your unique perspective on the topic that you're writing on? That one for us, frankly, tends to be pretty easy because we're neonatologists and we're staying within our area of expertise. So we're writing about this because we're experts. And then what changed? What do you want people to do? Do you want people to learn about this? Do you want people to support the rule? Do you want people to call their legislator? What action do you want people to take? The other thing you should do is, even though this isn't always true, you should start thinking at least a little bit about where you want it to place the op-ed. And that's because it's going to depend on which audience you're trying to reach, right? So, for example, Kevin MD and Medscape reach primarily a medical audience, but it's not an audience of pediatricians. So you might spend a lot of time talking about things that are unique to pediatrics. US News, Newsweek, the New York Times, these are obviously general interest publications. So you'll have people who are educated, but aren't necessarily educated about anything related to the medicine you're talking about. And then if you're going to do something that's more in depth and requires significant references, and then you're thinking really not about an op-ed, but about a commentary for a peer-reviewed journal like Pediatrics. So there are two types of things you'll do when you do an op-ed. And right now, I would suggest that the best thing for you to do is write the op-ed. Once you have it written, you'll hear me say this a couple of times, someone somewhere will take it. It might not get into your first choice publication, but there are enough outlets now that are interested in content that I think that if it's somewhat well done, there is some outlet, whether it's Kevin MD, your local AAP chapter blog, um, that will take it. All right. But if you ever have to go through pitching an op-ed, which is writing a letter to an editor, to an op-ed editor saying, hey, I'm going to write this op-ed. What do you think? The most important thing is be familiar with the submission guidelines. So don't send them 900 words if they say they want 700. Make sure you have an opinion, right? This is important for us to support. This is important for us to oppose. Explain your expertise. That's easy. You're a neonatologist, probably at the major level 4 center that could be in that state. And then, of course, making it timely, right? What's the hook that makes people want to read this now? Don't submit to multiple publications at once. That's just bad form. just like journal articles. They'll usually say in the submission guidelines, if you don't hear from us in 48 hours, 72 hours, then assume we don't want it and you can send it to someone else. Um, it's not like a journal where you're going to see a proof. They will take it, they will edit it for usually for length and maybe a little bit for meaning, and then they will publish it. They won't necessarily come back to you multiple times unless there's some jargon in there that they haven't really encountered and they want to make sure they're doing it you justice or saying something correctly. But it's usually once it's accepted, it sort of belongs to them. So what are some of the basics of op-ed writing? Well, make it timely is there in red and at the very end. So we'll talk about, you'll hear me say that multiple times. Make sure it's 600 to about 800 words. Some places will only do 600, some will do 800. 700 is obviously a good sweet spot. Stay off the jargon, which is very, very hard for me particularly. And remember, the good old-fashioned rules of writing always apply. So make your sentences shorter, make them relatively simple. Try to use active voice, which is really tough because all scientific writing and most grant writing is all in passive voice. Make sure you establish your expertise early on. Why are people needing to hear about this topic from you? That's going to get them to keep on reading. And then, of course, make sure that you have an argument, something that you want someone to do or someone not to do. Don't just say, the Preemie Act does this. No, we should support the Preemie Act because it does this. This is why it's important. It does this. That's why that's important, right? And listen to me because I'm the neonatologist who's taking care of your babies. Uh-oh, hold on. There we go. All right, so Sex Fiend Bear's Diary is kind of a little bit of an off-color phrase, but it has a historical aspect to it. Some of you, well, I was going to say all of you probably don't know who this gentleman is. That's R.W. Apple Jr., the former politics editor for the New York Times. And he was straight out of 1970s central casting for a newspaper man. He always had a notepad, was, a chain smoker, had one of those, had a typewriter and a telephone right by his desk and was just banging out copy and talking to people. Now, he was on a panel along with people from the Washington Post, and a student asked them both, what is the best headline ever written? And the person from the Washington Post looked at the student and said, well, that's very simple. It's Man Walks on Moon. Nothing else evokes anything related to the majesty and sort of awe of that headline. And R.W. Apple turned to his friend from the Washington Post and said, no, that's actually the dumbest headline because everyone's going to read that article. The most interesting headline is Sex Fiend Bear's Diary. And the reason was that every single word has some degree of curiosity embedded in it, right? Diary, oh, well, that suggests secrets, right? Fiend also suggests someone who might be a little bit malintentioned. And so he said, you should always be writing kind of like this. Each word should have a purpose, right? So you want to establish something that makes people want to read, and that needs to be something that's attention grabbing and happens just at the outset, right out of the gate. It could be something about why this is so incredibly important. It could be about the large number of kids that are involved that grabs people's attention, or it could be personalized and say, hey, these kids could be your kids. You want to establish your expertise. And like I said, for us, this is pretty easy. You're a physician in that community. You're a researcher on that topic. You're a neonatologist at the major medical center. And we will talk about whether you can identify yourself with the major medical center a little bit later, but the gist of that is do not, unless your government affairs or your marketing department has vetted the op-ed before it was submitted and agrees that it's consistent with your children's hospitals or your department's sort of values. The reason you do that is because sometimes those marketing folks and publicity folks have newspaper contacts and might be able to help you get it published. But then you're always free to submit as a person in the community, and you just identify yourself as a pediatrician or a neonatologist in the community. That way you're dissociated from anything that's occurring specifically at the hospital that employs you. And then, of course, the action point. What are you asking people to do? So you need to have about 3 points, and you can roughly think of these each points as kind of a paragraph. And each of these paragraphs are kind of structured with data, so you can educate people and establish your expertise. Experience, I know this is true because of what happened to me in my NICU last night when I was on call. And then quickly, just one conclusion sentence. If you have space, a lot of people talk about this sort of there are concerns paragraph, which are the kind of a dual paragraph structure at the very end where you say, there are concerns that doing this could increase taxes or could alienate people or could worry people who are concerned about Second Amendment rights. And then, of course, the next one is to be sure, or now that you've acknowledged the other side, you can say, however, nothing is more important than the health of children and the welfare of babies. And then you can conclude very quickly. So how do you put it all together, right? So this is just a template that I used from 2023. And it was basically about what children need in 2023. So what are the New Year's resolutions for 2023? So first I had to think of something that was kind of catchy, right? And I knew that the three things I wanted to talk about were children need increased levels of COVID vaccination because we had a triple demic. They needed more bed space because of the triple demic. And because of the triple demic, all the over-the-counter, Tylenol, Motrin fever remedies were all in shortage. So they need better access to those things. So how do you put all of that in something that's a little bit attractive for someone to read? Well, right out of the first sentence. So here are just a couple, right? After a disastrous 2022, we can resolve to make 2023 better, or let's make 3 resolutions, or just when you thought kids things couldn't get worse. Hopefully you read that one line and you're interested enough to read the next line or the line after that. Once you talk a little bit about those things, you want to at least have one paragraph fairly in the top that establishes your expertise, right? I was a frontline pediatrician, or parents of my patients are worried, or in my neonatal intensive care unit, siblings of my patients are. Something that says you're living this work, and that's why people should care. You can break down each of these paragraphs to some data, then some experience, and then a little bit of a conclusion. And that, remember, these paragraphs should be short, no more than 4 or 5 sentences. So if I had 3 points, I knew that I was going to make each one a paragraph. So one was the COVID vaccination rates need to increase. So a data point, how many immunizations have been given? That, again, gives you a timely aspect. How many new cases of COVID are happening? Tie that to what's going on. Patients in my clinic, that's long-term follow-up clinic, or patients or my colleagues are telling me that there's a lot of problems with parental acceptance of vaccine. So what's the conclusion? Well, it's safe and effective and people should get it to protect themselves given all these new COVID cases. Point 2, like I said, we need more pediatric bed space. Again, what makes that timely? Well, there's this flu, RSV, and COVID triple demic, right? We've lost a lot of pediatric bed space because adult bed space pays a lot more. What do I know? Well, I know that in my hospital, kids are spending all this time waiting for beds, and people are being transported out of state because we don't have ICU beds. So what's the conclusion? Well, we've got to prioritize children's health. We have to make sure that we have the bed space that we need, because otherwise there won't be any bed space when your child gets sick. And one of the ways to do that is to pay equally. And then finally, the medication shortages. And you can kind of see how this theme is working, right? Shortages of medications, again, makes it very timely. What the FDA is saying, that's another data point. What I'm experiencing or what you're experiencing. And then when this is over, we need to review this entire process to make sure it never happens again. If you have time and if you have space, there are concerns, right? So there are concerns and then to be sure paragraph, right? So there are concerns. There's vaccine hesitancy, but we know, I understand there's vaccine hesitancy, but COVID vaccines are safe. There's a lot of costs for providing Medicaid parity and paying the same amount for the care for children as we do for adults. However, we should all endeavor to treat children equally as we do adults. Shortages are just a temporary problem, so we don't need to spend a lot of time. It's going to fix itself. Yes, but we need to make sure that we're prepared for the next time this happens. And then just one quick sentence that takes you back to the beginning, right? If we resolve to make things better, these are the changes that will make things better. So this is what that looked like, what pediatricians are hoping for, and then what it looked like when it was published online. All right, so now let's talk about, hopefully you guys have gotten the worksheet, but let's talk a little bit about the Preemie Act. So let's say you're trying to put something together, and this is literally what I did when I'm thinking about writing my own op-ed about the Preemie Act. So this is the first part of that handout. The example here is based on an op-ed that we did, or that I did a couple of almost 6 months ago, when then President Biden decided to shelve the FDA proposal to prohibit any sales of menthol flavored cigarettes. So you'll see a lot of the examples, or all the examples, relate to menthol and cigarette smoking and their impact on kids. But you can always fill this out based on your own. So what are my 4 simple questions? Well, what am I arguing for or against? I'm arguing for reauthorization of the Preemie Act. Okay, that's pretty simple. Well, why is it important now? Well, it's got to be done by the March federal budget deadline. It was supposed to be done, but then it was pushed back. All right. Well, what makes you the expert? Well, the same reason all of you on this webinar are experts, right? You're all neonatal intensive care doctors. You all have firsthand experience with all of the medical problems, the societal problems, the emotional problems that are created by prematurity. And you all, directly or indirectly, have benefited from some of the programs that the Preemie Act funds for a very small $10 million price tag related to a $7 trillion budget. So what actions do you want readers to take? Well, you want them to write your congressman. You want them to support this measure. You want them to understand that these babies need this type of legislation. Now, you see here on the bottom these cheat words: recent, earlier this year, current discussion. These are ways to make things sound timely that aren't exactly happening that week or that month, right? So the decision, for example, to not reauthorize the Preemie Act in the budget reauthorization and to create a continuing resolution until March occurred in December. Now, December is not exactly the most timely if you're a newspaper person writing in January or February, but you could say the recent decision to postpone reauthorization of the Preemie Act until the new March federal budget deadline gives it this sort of mystique of, okay, well, this just happened, and now there's this looming deadline. So it sort of puts it all together. All right, so now, what is what people call the SOCO, your single overriding communication objective? And this is something that I guess media people teach, and the American Academy of Pediatrics teaches a lot of its designated spokespeople. So the example here comes again from that menthol ban. So what's the single objective? Implementing a menthol ban is common sense to improve public health, especially given how many people are starting to use these flavored tobacco products at a young age. So what's my single communication objective for the Preemie Act? So the Preemie Act is the federal government's sole commitment to addressing prematurity, which impacts 1 in 10 babies and can affect them for life. Okay, that's why we need to support the Preemie Act. All right. So what's the eye-catching one sentence that's going to grab their attention? What's the first thing that you're going to start this op-ed off on so that someone says, okay, I got to read the second sentence? So I came up with 3. I usually just poll the group and ask people what they like the most. Congress is trying to balance its checkbook on the back of premature babies. That's people saying we don't need the Preemie Act because we need to balance the budget, or we need to have less federal spending. Babies can't vote, and Congress knows it. That's why they're prioritizing programs that benefit adults. Or Congress can't act early enough. Get it? Early enough, premature. Congress can't act early enough for babies born prematurely. Now you need to explain what's going on. So someone's read this headline, is kind of intrigued, but now they need to figure out this opening lead, and now they want to know what's going on. So you can explain what's going on and do it in a way that makes it timely, right? So Congress failed to reauthorize the Preemie Act during the December budget package, creating a new self-imposed deadline to fund programs that impact 1 in 10 children born in the US, or programs for premature babies. So now someone's like, okay, now I get it. There's this Preemie Act and there's this budget package, and this all has to be done by March. And you can go on to explain what the Preemie Act is and what it does. So now that you've talked about what Congress needs to do, before you make the case about why, you want to remind people why you're the expert, right? Hint, you're the doctor, right? So as a neonatologist practicing in blank, I care for tons of preemie babies, right? So no one else or very few other people know what you know when it comes to prematurity. So once you talk about what Congress needs to do and why they need to do it, you can talk at the beginning of the next paragraph about why you are the person, right? Now that you've explained, you've got their attention, you've told them kind of what needs to be done, right? There's this deadline and Congress needs to reauthorize the Preemie Act. You've told them in the next paragraph, you're the expert, this is why it needs to be done. Now you can start building your case and getting a little bit more in depth, a little bit more data. So what are the data points, right? Well, prematurity affects 1 in 10 babies. That's a pretty common point that we all know. It's one of the most common causes of infant death, second most common cause of death in children under a year after congenital anomalies. And then what's our experience? Well, the experience is that we have lots of tools to care for preemie babies, but the best way for them to do well is for them not to even be born premature. That's your experience. That's what you know from taking care of these babies for as many years as you have. So what's the second sort of substance paragraph that you can talk about? Well, the data point here, again, this is the example for menthol, but it's the only federal support for everything that we do and that the federal government does as it relates to healthcare. And that's Medicaid, Medicare, NIH, huge portions of the federal budget. This is the only earmarked federal support specifically for preterm birth. Then you can go a little bit into what the Preemie Act actually does. It supports research on prematurity. We talked about the HRSA program and simulation, and I can say I personally participated. This is your experience in simulation training, and that's allowed you to be a potentially better neonatologist, which is what you want if you're a mother or a father and you see me walking into your delivery room. You want someone who's practiced or someone who has experience. And then what's the third paragraph point? Well, again, we're getting into more data here, right? Well, there's a lot of concern about government spending, but it only costs $10 million, which is a bargain in the context of the federal government. What else does it do? Well, one thing that's unique in this year's reauthorization is that report on how much prematurity costs and what are the gaps in the literature, right? So it authorizes the first study in over 2 decades for something that has remained a major public health problem. And more importantly, for my work as a neonatologist, it'll help guide me so I can help take better care of infants and mothers because it'll identify gaps in the literature that researchers can address. It'll define gaps in healthcare access that allow me to take better care of mothers and, more importantly, their babies. All right. So you guys have done it, right? You've pretty much written your op-ed. You're good to go, right? So now that you have your 700 or 800 words, the thing to remember is once you write it, it will be seen. I've talked about writing op-eds a couple of times, and the number one thing I hear from fellows and pediatric residents is, I'm going to spend all this time writing it, Shetal, and then no one's going to take it, and I'm going to feel like I wasted my time. And I am telling you right now, if you write it, right, if you build it, they will come. Once you write it, it will be seen. All right. So just think about the best venue for your topic, right? Is this a national issue? Like we talked about, think about a national newspaper, CNN, The Hill, if it's if it's a healthcare related policy issue, Politico. If it's something that relates to a specific issue, like for prematurity, think about the March of Dimes website. Call them up and see if they're interested. When I was doing something on the smoking issue, I asked the American Lung Association, I said, hey, if it doesn't get accepted by a newspaper, would you consider it putting it on your website as some sort of blog post? Because they knew that they had uh, that type of space on their website. And they said, sure, just let us know. If you're talking about the local impact of a national issue, which is another way of framing a national issue, you can also shoot for your regional newspaper, right? The Preemie Act hits us very close to home in Insert My Town because we're the only level 4 regional center in our state, or we're only one of New York. We're only one of 18 centers in the state. If it's a state regulation or a state law or something you want the state to do, for example, Medicaid policy in your state, look at the regional chapter or contact your AAP. Most of them are state-based chapters, New York and California excluded, and see if their chapter website will take it. A lot of them have blogs. And if it's an ultra local issue, we've done work, as granular as the county. Look at your community newspaper. That's the stuff you pick up as you're heading into the grocery store. And this is just to remind people that once you've decided where you're going to go, just like a journal, it's a tier system. So shoot for a higher reach publication, and you can go to the Op-Ed project submissions. It lists every newspaper that takes unsolicited Op-Eds and gives you the contact information of how to get something in front of those editors, the editor's email, or a link to an online form where you submit it. Tier 2 are sort of regional papers. I will say this, and this is just might be a New York thing, but the Albany Times-Union is really important because all of our legislators in Albany read it. So if you want something that's done at the state, getting it into the ATU is a big deal. And then, of course, tier 3, I put things in literally my town newspaper next to all the pictures of, the little soccer tots team is a letter to the editor about the impact of a local issue, right? Or the AAP chapter blog. There is a space for anything you will put together. So now it's your turn. What I want you guys to do now, hopefully you've looked at the document that I've given you. We've gone through it, at least for some degree, for the Preemie Act. And I want you guys to think a little bit about what you would put down. You don't have to fill out the whole thing, obviously. No one's going to make you do that in the next couple of minutes. But I want you to start thinking about what you would put down. It might be something that you saw that relates to maybe simulation, or a presentation you put together where you needed something from the CDC or a fact point, or it might be something related to maternal mental health or maternal health that is funded by the Preemie Act. It might be the fact that that report is going to be really important to you because you're a researcher, and it'll help you figure out the best ways to guide your research so it can have maximum benefit for the health that's delivered. And with that, I will take any questions. These are just some examples of blog posts. So I'm going to stop sharing now. Let's see if that works. I'm going to open my video up so you can all see me. Oh, wow. There's no background on this. That's exciting. And then I don't know why it's not. My background's pretty cool, but okay. Uh, are there any questions from anyone? I know we got started a little late, so I apologize for that. But so we were hoping to have about 15 minutes or 10 minutes for questions, and now we only have a few. But who are the 22 brave souls? Who's going to be the first one to ask a question?
Question: does the kind of tone or the flavor of the op-ed piece change whether you're for or against whatever the issue you're writing about? Like a lot
Yeah,
of examples you gave, you were, I guess, for things happening versus being, against them.
it doesn't have to be. Like, you don't have to be, this isn't the type of thing where the loudest or angriest voice wins. If something's going on in your state, I'll give you a classic example. There was an adolescent medicine fellow who contacted me for help because she wanted to write an op-ed about abortion restrictions in her state and how she opposed them. And that's, fine too. And, just the message is that you don't want the message to be like, these people are idiots, right? But the message is that these policies are not consistent with the medical data, which I'm the expert in, right? With the medical data as it relates to pregnancy and reproductive health. You don't have to say, like, you don't have to be inflammatory and say, well, these policies are going to kill women, or these, like, you can say that there's increased mortality. Um, but I think as long as you stick to the data and your experience, you're going to be fine. Does that answer your question? I think was that Keandra?
Kedria, yes, that's helpful.
Kedria.
Mhm.
All right.
And then my second question, so some of the examples you gave are like, I guess, like you can directly relate them to medicine, but what about some things that are more like upstream things like Medicaid or funding for public education, or things that are
Sure.
take a more circuitous path to the outcomes that we see.
Yeah. Well, I've done some stuff on Medicaid, so I can definitely tell you that Medicaid, by definition, you're an expert in Medicaid. And that's because anyone who takes care of children is an expert on Medicaid, right? Because you can establish the relevance of that very quickly, right? Medicaid is most likely the biggest child insurer in your state. I don't know what state you're from. Um, that's number one. And number two, you probably know off the top of your head, and if not, ask one of your attendings. They will know off the top of their head what percentage of the babies in your NICU are covered by Medicaid. So that gives you sort of a front seat into how potential changes in Medicaid might impact the care that your babies get and that your patients get. So that's not necessarily an upstream thing. It it's just how you explain it, right? And fair housing or housing policies, you can just say, I take care of premature babies, I take care of babies who are sick, and it's well known that stable housing helps improve the health of mothers and babies. And that's why you care, and that's why you should care, right? And I think that that would work well.
Thank you.
Is that helpful?
Yeah, that's helpful. Thanks.
All right.
Hey, Shetal, this is Jason.
Oh, hi, Jason. What's going
How
on, man?
are you? Oh,
This
not
is fun.
much.
This is like informal. I
Yeah,
like it.
just celebrating the Buckeyes win last night. So if there's any Ohio State fans on here,
Hey,
quite the
look,
game.
I'm a Giants fan. We're only a quarterback, an offensive line, a defensive line, a secondary, a running back, and a special teams unit away from contending for a wild card.
There you go. Um, so first off, this was an excellent talk. This is even a great, as someone who has written some op-eds, this is a great refresher. The question that I had is, uh, a lot of times we're asked to write op-eds on something we are not experts on, or to help
Yeah.
something that we're not experts on. Like I've been asked things about like gender affirming care, which I don't
Yeah.
I don't do gender affirming care.
Yeah.
um, so especially in a world where a lot of the things we're writing on are so hot button, and it's so like you can read, like if I'm writing a pro gender affirming care, I am putting a big blue D on my chest, like they know. Um, how do you present yourself as not an expert in the topic, but an expert in pediatric medicine, or a person who is an expert in evaluating the evidence, to still give your words the same clout as if you were writing about a neonatal issue?
Yeah. So what I will tell you how I thread that needle. So if I'm asked to write something about something that I don't necessarily feel comfortable with, but I feel comfortable like doing the writing, like I feel comfortable putting the op-ed stuff together, find a partner who does know, right? Because gender affirming care is the type of thing where you might want to call up one of the adolescent medicine folks and say, hey, let's do this together. Most op-eds will allow two authors. Most of them won't allow more. And you can certainly find out. That's why you saw me do. We did one with Dwayne Persley, who's a neonatologist, but also one with Dr. Cheng, who's general pediatrics, and Mona Patel, for those of you guys from California, who is also general pediatrics. So you shouldn't necessarily force it, but there are a lot of issues that you guys are comfortable with. You just don't know you're comfortable with them, right? And I say that all the time, right? You guys are comfortable or should be comfortable with Medicaid. That's number one. If you're not, you can get comfortable. There are tons of resources out there to briefly and quickly explain what Medicaid is and how it affects the patients you take care of. Reproductive health care is obviously something that directly affects you, even something like smoking, right? Because babies of mothers who smoke are overrepresented in our NICUs because, of course, the association of nicotine and intrauterine growth restriction and all of that. So you guys can be experts in a lot of things that you might not at first glance think you're experts on. But if it is something that's really, really out of your wheelhouse, get a partner. And I do that sometimes with our children's hospital, like our CEO or CMO talking about things that relate to children's hospital financing, right? It's one thing to say there's a Medicaid policy and I'm against it because it's going to hurt access to care, or I'm for it because it'll promote access to care. There's another one where you say, this year, the state needs to prioritize increases for inpatient Medicaid payment because this children's hospital works on really slim margins and there's an economic engine to that piece, right? Like you want to fund your children's hospital, not just because you want to give kids equitable care, but because we're the biggest employer in the county, like that type of thing. And that's a different angle.
Shetal, I have a question for you. So say you're interested in writing an op-ed around the Preemie Act. Mm-hmm. From your perspective, is it better to do this in a coordinated fashion, like push it out as a group to different like different people writing different op-eds to different papers, or is it best just do kind of as it comes?
I think this is the type of issue where smoldering is, I mean, again, this is my opinion. The AAP has a huge communication staff that sort of thinks about these issues, but my first glance is for something like this, where it's really about reminding people that this is an issue and that this needs attention, kind of constantly banging the drum is probably a good thing. Certainly when it comes up for a vote, or if it's the week of the vote, you might want to do something that's a little bit more punctuated, like coordinate a lot of people calling their legislators or something like that. Phone banking is a very big thing. But, I don't think there's anything wrong with saying, hey, we have an op-ed in this paper this week, and then in another week, and in another week, and in another week. So people never lose focus of the fact that one of the things that needs to get done is this reauthorization. And I think the fact that you guys I think you're aided a little by the fact that that March deadline's coming pretty fast. So if you write something now and get it published and submitted in February, it's not March, it's next month. That's pretty immediate, right?
Follow-up question, would you be willing to review people's op-eds
Yeah,
as they write them?
absolutely. Yeah, for any one of the participants who are on this call, if you guys want to put something together and you want me to review it with you, I've done this a lot. We'll just get on a Zoom together, we'll put it up, and we'll sort of talk through it together. And usually it doesn't take more than 45 minutes or an hour if there's something already on the page. And we can kind of put it together and give you some idea. And then you can go about submitting it. That's actually a lot of fun. That's what Dr. Bernstein and I kind of got together, because she wanted to talk about why this was important, but she'd never done it. She actually is an amazing writer, but I don't think she'd submitted an op-ed to that particular paper, or if she had done, she didn't do it on that topic. So there are always ways where a partner is helpful. And I think you guys can feel free to share my email. All right. Are there any other questions? They're all asleep. See, this is what's bad about Zoom. Like half of them are. All right. You 4 people who are undecided. All right. Email me and we'll figure it out together, because I don't think you're undecided. I think you want to do it, and you might, maybe I'm wrong. It's not undecided so much as a little intimidated, but that's okay.
I'll speak from personal experience that Shetal guided me through writing my first op-ed, and it was a great experience, and he's a fantastic mentor. So I really encourage anybody who's kind of on the fence to just take the plunge and go for it.
All right.
Well, Shetal, thank you so much for joining us and sharing your expertise and knowledge. I'm hopeful that this is the beginning of kind of a recurring quorum of neonatologist advocates who can kind of harness the power of the crowd to really advance issues that are important for us. So hopefully
I'm
more
gonna
to come.
Yeah, just one quick thing first of all, it's really good that these things are like just about an hour, because if you have to share your expertise, like I don't have any more expertise after the hour. Like there's nothing for hour two. So you guys have seen it all and done it all. Um, the other thing is that I do think it's really important for us to speak up. And I say that because there's a lot of oxygen about children's health issues in general. And general pediatricians, just by virtue of the fact that there are like 63,000 of them and there are only 4,000 of us, they're going to write about what they're comfortable with, right? And that's what that really means, is that when people start thinking about sort of the landscape of children's health issues, they're going to start thinking more about what the general, quote unquote, general pediatric issues are. And that makes us a little bit more invisible. So it's important for us to make sure that people don't turn their heads away from babies. All right. And I can tell you that as much, the joke I always say is that, every legislator cares about babies until the day after election day, right? And then all of a sudden, it's not as important. And we're the ones who make sure that they stay focused on those things. So if you sort of think about that as your purpose, hopefully that takes those 4 undecided people and motivates them to sort of to get writing. And if you guys need more information on the Preemie Act, there's information from AAP. The March of Dimes has a really great sort of breakdown of all the different provisions. You can look at them and be like, oh, that affects me, or oh, that was important, or oh, that's where I got the HRSA provision about the simulation training. And you can take it from there.